Yeah, it's a lot. And you kind of get numb to it a little bit because you see it so much.
Numb. After another year of hundreds of people dying of overdoses, those on the front lines are worn out. Dr. Sterling McLaren never gets a break.
I think it's a big concern. It's a big problem. It hasn't gone away.
As Denver's interim chief medical examiner, Sterling saw Denver through its deadliest year for overdose deaths in 2023. 2024 brought respite when overdose and fentanyl deaths dropped sharply, but this year, that good news faded fast.
March this year was the worst month we had, I think, on record.
We have recently found out that there were 61 overdose deaths just in March this year, which was a huge increase. That was more than 2 a day.
Lisa Rayville runs the Harm Reduction Action Center. She says people are dying publicly, overdosing in parks, alleys, and bathrooms in businesses. So far this year, the medical examiner's office reports nearly 500 people have died of an overdose in Denver. 328 of those involved fentanyl, putting 2025 the second deadliest year for Denver overdoses, even with data lagging months behind.
Waiting 12 to 18 weeks to see what was happening 12 to 18 weeks ago is not sustainable. We need real action items for today. For example, we need robust on-site drug checking. There are 2 drug checking machines that are sitting in boxes in a city and county building underneath someone's desk.
The Denver Department of Public Health and Environment says they did buy drug testing over the summer, but they're still getting the people and training they need to use it. Marion Rourke, the city's access to care manager, says more help is needed.
It's really, really hard day after day after day for folks to learn about folks who have passed and to think, did we have some other opportunities to support them? What could we be doing different, right? So it's gut-wrenching.
As more people die daily from drug overdose, Rayville believes it's past time to try something new to turn around this deadly trend.
We've been asking for this. We've been pleading for this. People are dying. They're dying publicly. It doesn't have to be like this. We can be trying things that do something different.
The Denver Medical Examiner's Office is often when people are overdosing, they have more than one substance in their system. Fentanyl, yes, but often methamphetamine too. And they're seeing fentanyl showing up less and less in the pill form that we've gotten used to, and much more often in a powdery form. That's concerning, of course, because that can look like a lot of other substances. And while it can't work for everything, having naloxone on hand can make a big difference because it can save a life if somebody is overdosing on an opioid like fentanyl. Reporting live in Denver, Rachel Krause, 9 News.